More than 400,000 Americans received booster shots against COVID-19 last weekend. Here to answer your questions is Dr. Helen Boucher, the interim dean of Tufts Medical School and an infectious disease specialist at Tufts Medical Center. Dr. Boucher, always great to have you.
Nice to see you, Erica.
All right, Dr. Boucher, these booster shots have only been available for a couple of days. We know a lot of people who got Pfizer at least 6 months ago are now eligible to get them. But as a doctor, what type of patient are you urging to go get one?
Yeah, it's an important question. And I think the most important group are those among us who are the most vulnerable. So those are our immunocompromised patients, people who've maybe had an organ transplant or had chemotherapy for cancer, and the elderly. Those would be the most important groups to start thinking about getting that booster.
And Dr. Boucher, what are you learning about any side effects after this third shot? I mean, it seems so random. Some people have, these side effects and they feel crummy. Others don't feel anything. Should people be planning to stay home from work, say, the next day?
Yeah, well, the data that we have so far are quite reassuring. The side effects that have been reported after the third dose are very similar to those seen after the second dose. So in some people, a little flu-like feeling, achy, many have a sore arm, but really, by and large, mild, go away within a day, and for most folks don't need them, make them feel the need to stay home from work.
All right, a new national survey found 75% of people who are not vaccinated believe that these booster shots are proof the vaccines don't work. So how do we fight that? How do you respond to that?
Yeah, it's really unfortunate. So we have overwhelming data now that vaccines work. And whether we look at people who get sick, people who need to come to the hospital, or those really unfortunate people who die, we know that vaccines protect them. And if we look at places in the country, we're fortunate here in Massachusetts where we have so many vaccinated people that we have not seen the pain that our friends and colleagues in Tennessee, Idaho, and many other states are experiencing right now. So we have volumes of evidence that vaccines work. And the most important thing is that if you haven't been vaccinated, to get out and get that vaccination.
And some people who have received 2 doses of Pfizer, they may decide not to get the third. In that case, would you still consider them fully vaccinated against COVID? And do we know how long you might if you do?
Well, it's a very important point. Absolutely. If you've had 2 doses of either Pfizer and Moderna or 1 dose of the Johnson & Johnson vaccine, you are fully vaccinated. And we still today have reassuring data that you're protected against serious illness and death. So the big message is to get that vaccination if you haven't done it already. The question of how long that protection lasts is one that we are answering, right? As this happened in a pandemic, we're continuing to follow the data closely, and we'll continue to look for updates from those companies and the CDC and the FDA as time goes along.
All right, Dr. Helen Boucher, interim dean at Tufts Medical School. Dr. Boucher, good to see you.
You too, Ben. Thanks.